I can now hear you. Yes. Thank you so much. And thank you for joining us. I'd like to welcome Meredith Cohn, who's a health and medicine reporter for the Baltimore Sun. She joined the paper in 2000 after stints at the Virginian Pilot, States News Service, and the Hagerstown Morning Herald. She recently won the Pulitzer Prize for coverage of the Healthy Holly scandal that led to the mayor of Baltimore, Catherine Pugh, resigning and being sentenced to prison. She has reported on the Affordable Care Act, medical research and diseases, as well as having authored multiple articles on the coronavirus. Her recent articles have focused on critical issues, including COVID-19 vaccines, hospitalizations, implications for frontline workers, COVID tests, and also on differential effects that COVID has had on minority communities and a range of other topics. So, on behalf of the Political Science Department at UMBC, as well as the Center for Social Science Scholarship, we're very glad to have you here. So please join me in welcoming Ms. Khan.
Well, great. Well, thank you everybody for tuning in today. I am going to talk about COVID and disparities. And I do want to start by talking about those Healthy Holly books, even though it's not directly COVID related. I think you'll understand in as I talk. If you're not familiar with that story, those books were sort of these amateurish children's books that former Mayor Pugh had written for the University of Maryland Medical System. She was on their board at the time, and she sold them. We didn't know they existed. Nobody knew they existed, and it turned out she didn't actually write all the books. They didn't produce all the books. It was a little bit of a scam. We wrote a lot of stories about it. She ended up being investigated for this after our stories, and she resigned the board, and she eventually resigned as mayor, and she was charged with not paying taxes on the income from the University of Maryland, and she's now in prison. And so I bring this up because it's aside from the tax scam part of it, it was not an unusual situation. After our reporting, we found out that the University of Maryland Medical System, which is 13 hospitals, and they get a lot of taxpayer money, they had been giving a lot of business to themselves, to the board members, to people who they knew, and that's sort of the point of this, that's what institutions do. That is not unusual behavior. And this story had started with a tip from a state senator who was concerned that minority contractors were not getting any business from the university system. And she wanted to know what kind of legislation she could write, what we could do to bring some light to this subject. And it turned out what she said was true. They were not giving business to minority contractors. They were giving it to themselves. And so at the end of this, there was legislation. It did lead to legislation banning board members from self-dealing, from giving the business to themselves. But it did not. It never addressed that minority contractor issue. And it never led to any kind of, reckoning with the system. And I don't mean to call them out, but they, because hospitals do this, institutions do this. But what else weren't they doing? If you're only doing business with the same people all the time, there's that bias there. Are you also not bringing in? Are you not hiring people of color? Are you not? Is your outreach to the community culturally sensitive? And even I wrote a story about transgender patients. The forms at the hospitals don't even have a place where you can list a new name and a gender, because they just use the same forms that they've always used. So it's this very entrenched situation that is very difficult to change. And we write stories and we try and expose these sorts of things and get these changes done. But what happens over time when institutions do do these things. I mean, I don't think we live with the same kind of blatant racist behavior that we had in the past. There was a famous study, the Tuskegee study, in the 30s, 40s, 50s. I think it went on a long time, where doctors had infected Black men with syphilis without them knowing, to try and see how the disease would progress. And that kind of blatant thing doesn't happen now. There are laws, there are policies in place. There are institutional review boards at hospitals now to stop that sort of thing. But so what we have now is a little bit more, I don't know if the right word is sinister, but it's more, deep down in the system and harder to change. And so all this leads to this mistrust in communities of color. They've been excluded from the healthcare system, purposefully, unpurposefully, and it continues today. And so we're seeing that. Now we'll get around to talking a little bit about COVID. There's already been polling that shows that Black people don't want the vaccine. I saw one study that showed it was as low as 14% or something like that. So, but it's not just COVID that there's mistrust of, and this leads to people not having health insurance, not seeing a doctor. And if you look at all of the data, the disparities are just astonishing. Black people in Baltimore have higher rate, and across the country have higher rates of heart disease and obesity and asthma and all sorts of chronic conditions. There's more violence in these neighborhoods in Baltimore that are predominantly where African Americans live, and so it's led to this. There's this statistic I use in my stories a lot, to try and kind of jolt people into understanding the depths of these disparities. There's a 20-year life expectancy difference between the most well-off neighborhoods in Baltimore, which are predominantly white, and the toughest neighborhoods in Baltimore, which are predominantly Black. I mean, 20 years. I mean, that just, and it hasn't budged in the time I've been covering healthcare in Baltimore. And I just find that kind of a shocking number every time I include it in a story. And so it's not really a surprise that when we started getting data on COVID, that the same thing was true. More people are getting infected and dying. If you're a person of color, I think you're 3 times as likely to get infected if you're Black than if you're white, and 2 times as likely to die. And I think it's a little bit worse actually for Hispanic people, maybe a little bit less worse for Asian people, but it's pretty across the board. And we only even, know this because there was a big push to get information on disparities. And all states aren't even collecting it. Maryland is collecting it, but, southern states are not collecting this data, for example. So, there are a number of reasons for this, and we try and, write about them and expose them and kind of get change in real time if possible. People of color are they live in congregate living situations. There's multi-generational housing. They're the people who have to go out and do their jobs. They can't work at home like I do, sitting behind a desk safely in my house. They have frontline jobs. They're working in the meat packing plants. They're working in prisons. They're actually also in prison at far greater numbers, in places that can't be protected particularly. So, and it's much harder. So if you've already been sort of disenfranchised from the healthcare system, you're not getting tested as often, you're not getting treated as often. Maybe you don't even want to get treated. You have that mistrust of the system, or maybe it's something as simple as the bus doesn't go where to your doctor or to near the health center. So there's all sorts of these sorts of problems. So, how are things different with covering COVID? I've written a lot about different health disparities over time and different, one-off programs to try and tackle different, disparities. I would say that there's a lot of people that are paying attention to this now, and I think it has a lot to do with the Black Lives Matter movement. There's been sort of a reckoning, I think, in the country a little bit, and so the stories are more they're about the disparities versus it being kind of mentioned in a story. Oh yeah, if this data was collected, we happen to know that there are more, Black or Hispanic people with a certain disease. It is the story. A lot of politicians started demanding that information, and reporters echoing that that demand for that data. And so when they started developing vaccines, they made the researchers made a very big push to get people of color involved in the vaccination trials, which is very unusual to, be that specific. I would joke, because every time I would write about them at the University of Maryland testing another flu vaccine, they would just get people who were in medical school, who are already on campus, to come and get a shot. And that's how they would test the vaccine. But they tested a lot of people very quickly with these vaccines. As we know, we're trying to rush them out there because we all want them so desperately. 30,000 people in Moderna and 30,000 people in the Pfizer vaccine trials. And they made this big attempt. And even UMBC President Hrabowski went and got a vaccination and made it known, because in an attempt to try and convince people that it was safe for everybody to get it. And so we report things like that to try and draw attention to this. We'll see if that has any kind of effect going forward. There are a lot of plans that we write about for distributing the vaccines. They are, frontline healthcare workers and nursing homes, and they don't specifically say a lot about disparities, about getting it out to certain communities. Certainly, ethicists and planners at Johns Hopkins University, which has been producing a lot of reports about COVID, have been trying to push out this idea of the disparities and to try and tailor communications efforts to this community, and try and convince people to get the vaccine. Whether they'll be successful or not, and whether they'll actually target the communities, we'll see. President-elect Biden has named a person for his COVID task force to specifically address disparities, and so that would be racial, ethnic, age-wise, geographic disparities across the gamut, to try and see. I have to say, reporting on COVID, people are still very sensitive, whether you're talking about a disparity or you're just talking about the grimness. I wrote a story about frontline healthcare workers that ran Sunday, and one of the hospitals complained that the story was too grim, and it is a grim story. I didn't quite know how to respond to that, but people are very sensitive, and I think that the racial disparities issue is a tough one sometimes for them. So now you're talking about a tough topic where people are dying, and then no hospital wants to be like, yeah, well, all the Black people come into our hospital die at a way higher rate. So people are sort of, even if things are true and they're not alone, they don't necessarily want us to report them. So getting information is harder, and we can't get into the hospitals. They aren't really letting us in. So we're having to do what we can to get information from them on this. Will we see anything come from this when it comes to disparities and a change in policies or legislation? I mean, that's sort of the tougher part. Like, how, what do you do next? What have we learned from COVID? When it comes to these disparities, like how can they maybe get into these communities now that they've had like a touch point with somebody who's become sick with COVID? Can they engage that person to continue in the healthcare system, get a primary care doctor going forward. Maybe that's a silver lining here. We'll keep reporting in the short term, on treatments and vaccines and how it's affecting in real time and down the road for people of color, if they're any different. And we'll have to go from there. I mean, this has been kind of a tough haul reporting on this, and information changes too. That was another point from the beginning of this to now. We reported in the beginning you didn't need to wear a mask, and now we're saying yes, wear a mask all the time. And there were rumors in the Black communities that Black people couldn't even get COVID in the very beginning of this. So we have this role in trying to interview the right people, scientists and experts to try and debunk. But we have to be careful not to become part of the problem as well by reporting things that aren't true. And it kind of hurts me when I find that I've reported a number or something that turns out to be different. How do I address that in these stories that I write? But I'm hoping that they use this example of the disparities in COVID and kind of, at the hospital level, at the medical health system level, generally at the legislatures, how can they, make sure that healthcare is delivered equitably, and how can I, report on that as well. So that's sort of my overview. I kind of rambled a little bit. I don't know if anybody has some questions that I could focus me a little bit on something. I'd be happy to answer them.
Great. Well, let me start off just by saying thank you for sharing that with us. I'll go ahead and kind of lead off on the first question as other people are thinking about questions they might want to ask. And I really appreciate you highlighting some of the challenges, particularly around information. I have a colleague at UMBC who focuses a lot of his research on, what we call partisan motivated reasoning, right? And looking at how people perceive economic indicators very differently. But it seems that this is also certainly an issue in the context of COVID in terms of, who gets their information from where, and almost having, two realities around COVID. And I'm wondering, from the perspective of journalist and, a credible newspaper, how do you sort of address this when, trying to get information and trying to write to, even a public that may feel very differently on this topic?
Right. Well, I think we've grappled with that as a newspaper in general. I'm a middle-aged white woman, and I'm going to go and write about these communities. We've always tried to have, a diverse workforce. And I think the messengers matter a lot. And so, are people in East and West Baltimore even reading the Baltimore Sun? I don't know, maybe not a lot. So we've made an attempt to hire a diverse staff ourselves. And so when somebody goes out to a crime scene or goes to a health center, they look like the people that they're interviewing and talking to. And I think, in my case, I try and reach out to a diverse set of experts. So I'm not going to the same people all the time, and I'm not talking to the same people. I think the communicators really matter. The people I interview really matter. And we're not always going to people aren't always going to talk to us, I guess. And so we have to build trust and look like them. And I think that's the idea behind, like, peer counseling. Even, you get people who, Safe Streets in Baltimore is a program where you get people who've been through the criminal justice system to kind of talk to people who are, maybe have offended, and see if they can get through to them. So I think it's the same idea with reporting. is trying to look like the people you're trying to communicate with. And I think there are a lot of efforts with COVID to try and tailor the messages to different communities in different ways and go to where people are. Like I know when I wrote about the Affordable Care Act, trying to get people to sign up, they would go to Spanish language radio stations and they would, speak in Spanish. And that I think would help a lot. I mean, me writing just a newspaper story isn't going to reach, that population. So.
Great. Yeah, thank you. That outreach effort seems, pretty critical and sort of reflecting the population of those that, you're delivering the information to certainly seems like an important aspect to this. Let me go ahead and open it up to questions.
Hi, thanks for joining us, Ms. Cohn. I'm actually a Baltimore Sun subscriber, and I think I've read almost all of your reporting over the last. Actually, Healthy Holly got me to subscribe to the Baltimore Sun. So,
wonderful.
I'm curious. We're doing this lecture series as part of a class. I don't know how much you know about what we're doing, and we're doing projects as a part of that. And when we were starting that out, I was interested in. I work for a small business in the city, and so I was interested in interviewing small business owners who are struggling or their business is closed. And I found how emotionally difficult that was for people, and how just difficult it is to find people because you can't go door to door, you can't meet people in person. How has like the physical realities of social distancing changed newspaper reporting, do you think, in Baltimore? That would be the question.
For me personally, it's been kind of to say it's been difficult is an understatement. The hospitals, banned visitors early on, and I always try and do as many of my interviews in person as possible. And so you go there because even if you're interviewing, a doctor, even if you're interviewing somebody you've interviewed before, like that face to face, like just seeing people's facial expressions and kind of being there in person, you get so much more than being on the phone with people or even, on a Zoom call. And I haven't been able to go to interview anybody in person. And so I'm much more reliant on the hospitals to, like, if I want to talk to nurses, I have to ask them to find me nurses. And there's always been a little bit of that because a lot of people, if you work for a business or you work for a hospital, you don't necessarily want to talk to the reporter without clearing it with your boss first. And I certainly wouldn't want to ever get anybody in trouble for talking to me. But I'm in my house all the time, calling around, trying to get people to talk to me. And I would say that is the number one challenge of covering this pandemic. And even like I would frequently go and do like a man on the street if I wanted to kind of do an informal poll of what people thought of something. And like, going to a small business, I would just pop into small businesses and I covered the business community for a while. And you just go and you talk to customers coming out, you talk to people going in. But, now you have like this mask on your face. Even if you try and do that, nobody wants to stop to talk to you anywhere. So I would say getting, the real stories from businesses, customers, anybody is extraordinarily challenging. And I don't have any good suggestions. I mean, I've been in the city long enough that I had a lot of expert sources, but I didn't have that like frontline, personal kind of story. And I'm still not, all these months in, not sure how, I go forward to try and get those voices. Are you specifically trying to talk to small businesses? Is that what you're doing?
I mean, I was. I had a changed focus a little bit because it was going to be hard to generate enough content. But I'm curious because, and to a certain extent, health privacy as a concept has evaporated at this point in time. I don't think, I don't think anyone cares the way we used to about whether or not, I know that my girlfriend's colleague's husband's coworker has COVID. Like that's not a piece of information that I would ever about any other disease or prior to this event. But at the same time, like there is a disconnect between, and I think you identified it. It's possible to talk to experts. I mean, how many times has Lena Wen been quoted in various news sources in like the last 6 months? But actually communicating, like my neighbor next door, she had coronavirus and she went to Good Sam. She was there for some period of time and she survived. And she's an older African-American woman with pre-existing health conditions. And I'm not saying that's a success story. And I don't, it's hard to see those personal experiences of people who have actually gone. I know the New York Times has tried to do this with some of the reporting in the last couple of days about Brooklyn, but it's hard to it's difficult to see people's experiences reflected in. It does feel like you get this 30,000 foot view of what's going on.
Right. Right. I would say on the privacy issue, a couple things. One thing, I think having COVID may not come with the same stigma as some other infectious diseases. And so people may, and it's so widespread that I think people might not be as resistant to having others know that they have COVID. I think that there is some effort. Some people are very private about it. And we would never report somebody's COVID status without their permission, and a hospital or an employer would certainly never tell us. That's actually like a battle. We've gotten the state health department to publish data on nursing homes and now on schools where there are cases. And I would say that that's unusual because every year when I write about flu, they'll send me a message and they'll say, we've had our first flu death of the season. It's an adult who lives on the Eastern Shore. And that's all the information I'll get. And I'll say, well, what county? Like, I'd like county level data. And they will not give it to me because they're like, well, no, it's privacy. You might be able to identify somebody who had the flu on the, in Wycomico County or something. I'm like, well, that's crazy. We have wrestled some more information of the state on COVID, but I would say privacy is still a big concern. People are not responding to the contact tracers in huge numbers. They do not want to give out information about who they've had contact with. And there is a registry that the state started that you can get notified if you've been in contact with somebody who's had COVID. To sort of let you know to get tested or quarantine if necessary. And I think they said over 1 million people registered, but, there are 6 million people in Maryland. So, they're at 20%. So it's not a giant uptake on that of people volunteering to be contacted. So I would say there's still push and pull on the privacy here, but yeah, like you said, it is kind of more of a talker or gossipy. Like you wouldn't be like, oh, did you hear somebody has, the flu? You wouldn't talk about it like you talk about COVID, I guess. So I don't know if that answered your question, but.
Great, thank you. I'd like to pick up on one point that Quinlan sort of touched on and that you mentioned, and it's about sort of reporting, and certainly you strike a good balance in this in terms of your own reporting, but how challenging is it to, for example, balance, sort of the anecdotal cases that provide a narrative that really connect well with people emotionally versus some of the hard data and statistics and numbers right now with something like COVID?
Yeah, I mean, we call them real people when you get the person who's has the disease or is in the circumstance, And we joke with our editors a lot because they'll say, find me somebody who is, between 45 and 47, has 3 kids, is Black and lives, very deep. And I'm like, if it's that hard to find this person is not a representative of this problem. And maybe we shouldn't be trying to find that specific person. I think the best stories are ones that are representative of what's going on, or at least give you some information that you can use to relate to what's going on. And COVID is having so many different impacts on so many different people that maybe it's not as far afield to find that person in that weird age gap with the very specific circumstances. But it is a balance, because you don't want to put some crazy story out there and have it represent a situation and either scare people off from getting treatment, or make it seem worse than it is, or not as bad as it is. But and COVID is really all over the map. It's deadly for people, but we don't quite sure know why it's deadly. We know these risk factors, these cardiovascular issues and obesity put you at higher risk. Just being Black does not put you at there's nothing biological about a Black person that makes that person more likely to get COVID and die of COVID, yet that's happening. And so that's sort of the struggle in wanting to explain that situation. Why did that person die? But yeah, it's always sort of a line of trying to figure out, well, do we use this person? Do we not use this person? Is this person crazy? Is this and confirming what they tell us too, because people and I'm not a doctor. I certainly don't understand medicine all the time. So you always try and confirm what somebody tells you is a true story, and not just repeat what they say, and certainly not repeat what they say about somebody else. That's always a trick. And the Sun also has we have a policy, unlike some other papers, don't use anonymous sources for the most part. We will, but under very, very specific circumstances, and usually has to do with your health privacy, or your job is on the line or something like that. So we need to hear it from the person and then confirm what they say is true. But yes, it is a trick. We spend a lot of time, and now that trick is harder because none of us are in a newsroom together. So we do a lot of messaging each other, our editors, and getting on the phone and trying to discuss what's the best way to present stories, and who are the best sources to use, and where to get those sources now.
Yeah, thank you for highlighting the challenges. I imagine, yeah, given all the constraints right now, that just is so much more difficult to get access to information and kind of counterbalance those perspectives. So let me go ahead and open it up and see if others have questions. If not, I'm happy to keep asking my own.
I also always got more.
Yeah, go ahead, Quinn.
How do you think coronavirus has interfaced with Baltimore as an ongoing political crisis? So I mean, the city has been in almost constant changes in leadership for the last 10 years. And do you think that this is we're going to see an era of stability here? Is that I don't know. I know you're not a political reporter, but does this seem is COVID going to spite opportunities, do you think, for a more stable city hall, more stable police HQ, people's lives in East and West Baltimore? Or is this profound disconnect between, what happens in Harbor East and what happens in, anything east of Patterson Park going to continue to spiral out of control?
Yeah, that's a good question. I'm not a political reporter. I have spent a good deal of my last few months writing stories with our political reporters because COVID does seem to have a very big political element to it. Every time the governor talks these days, he or the mayor, it's almost always about COVID because it's this huge part of our lives right now. And they're spending money on it, and so we're trying to do a good job trying to figure out what they're spending money on, and what kind of the South Korean tests that the governor bought. We've written a lot about those, and they don't appear to work well. In Baltimore specifically, it's tough to say. I mean, it's preventing all these new leaders from being in the same room together, which I think is a difficult way to start a new administration. And certainly the new mayor of Baltimore he's been around a while, but he's young, and he needs to have surround himself with people to help him run a major metropolitan city. I don't know if it exacerbates problems, if it's bringing people together, violence certainly hasn't stopped during COVID. The 300 murders a year are still happening. That started with Freddie Gray 5 years ago, and it hasn't seemed to dent that at all. And I don't know if it's that people in East and West Baltimore are just going about their lives as usual. Like, do they go to their jobs? Are they wearing masks? Do they talk about COVID as much as people in Harbor East do and Roland Park do? I don't know the answer to that. And what they expect, I don't know what they expect from their political leaders. Do they expect them? I mean, certainly there's a jobs crisis. It's put a lot of people out of work. And there's, aid to families is coming to an end for a lot of people. Will we go off a cliff? Will a lot of people get evicted? Probably. I mean, that's sort of what I see. I don't really see any, positive on sort of those fronts, crime and housing, and this could get a whole lot worse once you lose. A lot of people aren't in stable housing to begin with. Does it, being homeless or being, food insecure during COVID, seems way worse than in regular times even. Are there jobs out there to get? There aren't even jobs out there at fast food to get now, because you can't just say, go get a job at McDonald's, because you're not going into McDonald's to, they don't need any more workers right now. The only people hiring are Amazon. So do you get on a bus, 3 different buses to go out to the county, to a giant Amazon warehouse to work, to try and, put food on your table? So I think that there's some really big political questions, like how much do you dip into rainy day fund? Like how can you get grants? Well, the Biden administration is certainly more likely to try and push more aid out to cities than the Trump administration. We know that, but will he get it through Congress? And how will it trickle down? Those are always the big political questions. Will it make it to the people who need it immediately and in the long term? So I think the city's going to be in a crisis for some time to come. That's not very hopeful. Sorry.
Yeah, and I'll pick up on this. We often think in political science about politics creating policy, but have long known that policy creates its own politics, right? And, right now, COVID-19 is such a salient issue. I wonder how it has impacted, your ability to get kind of candid information from political actors who have to kind of work within this sphere. Have you noticed any differences, or does it seem, is there sort of less willingness to provide information?
Um, yeah, I think a lot of politicians are very guarded now when we try and get information, particularly at the state level, which is kind of running the show more than the localities. Governor Hogan, keeps getting mentioned as somebody who wants to run for president. So he's trying to walk this line of I want to appear as though I'm taking very decisive action and I'm in charge, but he's a Republican, so he doesn't want to be like I am just throwing cash at this. So he's guarded, and he has these press conferences where he answers, and I mean that's a politician thing. You answer the question you want to answer, not the question you were asked, and getting I'll ask the same question of the state health department over and over and over again, and they don't answer and they don't get back to me. And then the governor says something in a press conference, and then his staff scrambles to kind of meet what he said. And that's frequently the case, with those South Korean tests, like we couldn't, where are they? Who's using them? The health department doesn't answer. And then he'll get up and, at a press conference and say, oh, we've used half of them. Their University of Maryland lab is using them, but now they're not using them anymore. So it's kind of working backward from how I normally work, where I'll go to, the experts on the staff to try and ask questions. And now everybody is sort of looking toward the leader, toward Hogan or toward the mayor, versus wanting to answer questions themselves. I mean, unless it's something that's, we've put in a public records request for, like I put in a public records request for which nursing homes are getting fined for not testing adequately. And so then I get that information most of the time, not all the time. So I would say it kind of flopped from how it used to work with, I didn't normally engage with Mike Reese, who's the spokesman for the governor, as often as I have been now, because they're centralizing all the information that comes out, because everybody is sort of thinking about what they look like down the road, how they've acted, deliberately, but not going too far, I guess, in certain cases. So in the mayor's office has been a little bit different in that they have allowed the city health department to sort of respond to questions. But it's always been like I know which health officers in which counties are more willing to talk to me, and which will be like, no, you have to go to the county executive to get a statement. And it's you just sort of learn over time. And that's how, like you mentioned, Dr. Lena Wen, who used to be the city health commissioner, went to Planned Parenthood. Now she's a professor at George Washington. How she ends up in the news all the time because she, is available to answer. She's very smart. And now she's unencumbered by working for a politician. She's not working for the mayor of Baltimore anymore. So she does not have to clear her comments. And so you're more likely to get a comment like we'll call and say the governor will not shut down restaurants, but he's shut down the schools. Like, why, how do we get the schools open? Do we have to shut the restaurants to stem COVID so we can get the schools open? She's unencumbered, so she can say that's a ridiculous path. We should be focusing on the schools. Whereas, somebody who works for the governor or somebody who's working, has kind of a boss, political boss, keeping an eye on him, isn't going to be quite as vocal, I guess.
Yeah, that certainly makes sense. I think stepping out of the, kind of the political sphere and being able to be independent are probably some great experts to be able to get. I did see two questions come in. So I think Catalina had one that she wanted to ask, and then Scott asked about handling disinformation around COVID. But if we want to let Catalina go first, and then I can circle back.
Hi, thank you, Eric, for this speaker series. I have enjoyed it very much. And thank you, Meredith, for talking about this topic. I was just curious to know if reporting about the immigrant population both documented and undocumented, has changed in any way? That's it. I just was curious about that.
Well, I guess like specifically about COVID, about reporting on COVID in the immigrant population.
Yes. So I know that there's also issues about, getting access to healthcare and feeling like they don't want to share their status, and also financial issues. Right. So I was wondering if you were able to, gathering information about that population equally challenging, or has it changed?
Yeah, it's all impossible. It's all very difficult. The immigrant population, even people who are here legally, are hesitant, and you can't blame people for being hesitant to talk to a reporter. Certainly people in this country, there's a lot of distrust of the media, and the Trump administration has not made my job any easier by bashing us constantly. But the immigrant population has always been leery, and I think that as I go to hospitals, if we didn't have an immigrant population, we wouldn't have a healthcare system. The immigrants are coming, and they're filling vital medical staffing positions. And so once you get somebody who is kind of more established, I think you get more help. We go through to talk to people who are just here. They're refugees or they're immigrants. They're legal or they're not legal. We go through organizations that help us talk to people. I wrote a story a while back with another reporter at the paper on people who mainly were working in these warehouses, like the Amazon warehouses, and the immigrant population that Amazon and everybody, they're trying to recruit. They literally work with refugee organizations to bring people to work in warehouses, because they're they'll give them a job which they need to get settled here, and so they sometimes will press them to talk to us, and that's how we're able to go in, and also which I mentioned before, the newspaper has been endeavoring to expand on its diversity. So we have some fellows now at the paper, one covering the Hispanic population and one covering the African American population, who came in and she's the one covering the Hispanic population is a Spanish speaker. So she's can go in and kind of get a level of trust that I can't get when I go in. So sometimes we partner, we work together on stories. But mainly we need help. We can't just walk. I mean, even before COVID, it was tough to just go walk into Highland Town and ask somebody on the street, like, hey, you're going to get a flu vaccine. Do you trust the healthcare system to give you, it's unfamiliar to them, A, to be approached by a reporter, and B, to go to, go get a flu shot. Maybe they didn't do that back home. So there's lots of groups in Baltimore working with the immigrant populations. So they help the immigrant populations a lot, and they help us a lot. And so we almost always need a go-between. And now it's, there's no way we can talk to anybody without a go-between, just because you can't go anywhere and just march up to people and talk to them. Did that answer your question?
Yes, thank you. I appreciate it.
Sure.
Great. And I think there was one more question that came in about, and you sort of touched on this in the last comment, particularly around President Trump, but how you handle disinformation around COVID and the growing distrust in the media.
Right. Yeah, I get some nasty email from people, and I try and not be thin-skinned about any of that. And I try and respond to all of my messages, unless it's just really over the top, and I know that there's no point. And I find that when somebody messages and says, from one side or another, from saying you totally got our community wrong, or just somebody saying something. A lot of time I'll write like a really long story and somebody will message me about like a grammatical error or typo, and it's just crushing to me. It's just like, really, did you read the whole story? And oftentimes I find people are very disarmed when I respond. I message and I always start the message with, thank you for your email. Thank you for contacting me. And then I try and explain how I went about, reporting the story and frequently somebody will make a point and I'll message and I'll say that's an excellent point. I didn't think of that. But I write about the same stuff all the time. So I'll be going forward, I'm going to keep that point in mind. Or I'm going to try and include that in the next story, or I'm going to, look into what your concerns were. And people get very disarmed. You get this sort of nasty, tone in an email, and then you message back, and then the second email you get from them, oh, I didn't expect you to respond to me. And so I think that helps a lot, but it's kind of one person at a time. And, there are all these people out there, and I find this lack of trust in the media really very upsetting. And certainly, and its criticism is not unwarranted sometimes, and reporters, we do tend to do things in a pack way, and you don't sort of veer outside of your your lane enough, or go see it bond enough. I think enough people have faith in the media. I think I think the distrust is a minority. It's probably a growing minority, and it's a vocal minority. But I think for the most part, but we do have a challenge in getting people to read the newspaper. I appreciate when somebody tells me that they subscribe to the paper. Even if you just read, a story here and there, if you're not reading it cover to cover, that's fine. I subscribe to multiple newspapers, and I pick and I choose what I read. I think that we just have to, it's good to get readers calling us and emailing us, because it does remind us that you're not writing in this black hole. You're putting your words out there, and people are going to see them, and you need to be responsible for them. And that means spelling people's names correctly. And that means getting it right, either in tone or in, factual content, and owning it when you're wrong, correcting the story, and having the digital paper makes that a lot easier. We almost always put the stories online before we put them in print, and that actually kind of gives you a chance to hear, an example. I wrote a story about frontline healthcare workers that ran in Sunday's paper. It was online Thursday morning, I think. And one of the hospitals called, and the hospital that complained that the story was grim. And I'm like, well, people are dying. Yes, it's a grim story. And then I had a clause in there that said, people go to the ICU to die. And they said, not everybody who goes to the ICU dies. And I was like, you know what? Fair point. Most people don't die of COVID. And so we changed that clause just to say where some people go to die. And it was a small little change, but it was they really wanted me to change that in the story. And so I think, the editors are very resistant to changing things once something's been published, even online. But they will agree when we overstep. And I think that we need to constantly be monitoring ourselves and responsive to the community.
Well, thank you very much. And I certainly appreciate your fair and balanced reporting, and you mentioning that, that story certainly highlights that at a time when a lot of sensationalized reporting sells. And, we certainly appreciate the work that you do and for taking the time to join us today. So please join me in thanking Meredith Cohn, Baltimore Sun reporter, Pulitzer Prize winning Baltimore Sun reporter. So congratulations again.
Thank you, everybody, for tuning in, and email me anytime, anybody.
Great.